Before we push pills, viewing traumatic brain injury from a biopsychosocial perspective. Nowadays, psychiatrists are often seen as pill pushers. Have some anxiety? Well, there's a pill for that. Got some depression? Yep, there's also a pill for that. You want long-term therapy for more comprehensive change? Sorry, but managed care won't cover that. But isn't there more to diagnosis and treatment than identifying a list of symptoms and just prescribing a drug? I think TBI is best viewed from a biological, psychological, and social perspective. Injury occurs to a person with a particular physical status, life experiences, coping style, and particular current relationships with individuals and organizations. Secluding himself in a bedroom, darkened to match his gloomy mood, brain injury survivor John stared blankly at the TV. His thoughts turning inward, he sighed heavily under the weight of deep, unremitting despair. Shortly after returning home, his buddies quit visiting. In hopes of attracting girls were dashed by the confused, suspicious, frightened, and wary reactions of others to his slowed speech and awkward gait. So how do we understand John's problems after brain injury? And how do we help John make the best possible recovery? In today's healthcare environment, providers are increasingly asked to do more with less due to limited resources. And under this type of pressure, a potential pitfall is for us to take a narrow, expedient view and seek simple explanations for complex problems. Isn't it easier when all we have is a hammer? Yeah, then everything's a nail. For example, depending on how an evaluator conceptualizes John's problems, his irritability could be viewed as caused by one of the following factors: depression, impaired memory, inadequate sleep, poor nutrition, excessive or inadequate medication, unresolved psychological conflict, relationship disappointment, blocked flow of energy, pain, impaired mobility, lack of recreational vocational activities. But while it's tempting to focus narrowly on a simple answer, I believe we need to deal with significant uncertainty. In our understanding and treatment of John's brain injury, wouldn't it be helpful to have the following information? Is there a history of birth trauma or prior concussion? Did John abuse alcohol or drugs? Does he have diabetes or high blood pressure? Are his meds causing drowsiness or impaired concentration? How did John relate to his parents and other authority figures? Did he feel safe and cared for or insecure and anxious? How did he cope with having to depend on others? And how did he react when he was sick? Wouldn't this help us understand how he relates to his current caregivers and reacts to his current disabilities? For example, if John was raised by an uninvolved father and emotionally supportive mom, would it make sense for John's primary caregivers to be women? If he readily followed directions, would it make sense for caregivers to be firm and clear in their directions? Or if he was oppositional, would it make sense to allow John more choices in his treatments? If John was taught by example that masculinity was equal to self-sufficiency, would his disability result in fears of losing close relationships because he could no longer care for himself? And if, for example, he lost a sibling earlier in life, would the current disability reawaken the distress of earlier loss, including guilt of his surviving when his parent or sibling did not? What if John's primary support group was composed of long-distance bicyclers or, on the other hand, a chess club? Would his friends continue to visit when impaired mobility or memory prevented John from participating? Would John benefit from emotional support and education of a brain injury survivor group and a peer mentoring relationship? In today's climate, we're certainly challenged by multiple factors interacting to result in our patients' disabilities. It would be so much easier to take a narrow approach. But hopefully, motivated by caring and concern for our patients, we'll still find the time and energy to view complex problems through the biopsychosocial perspective and deliver the best quality of care.